My week 9 flashcard is on epilepsy. Pardon my voice. Epilepsy is a neurological illness that it causes recurrent seizures as a result of abnormal brain activity. It affects people of all ages, but is more common in men and young children. Genetic mutations, structural defects, metabolic diseases, infections, and other factors are all potential causes. Demographics encompass the early infancy and later adulthood, with some age groups at higher risk. Epilepsy affects 1 to 2% of the world's population, with new cases developing at varied rates throughout age groups, with the highest frequency being in young children. Pathophysiology. Epilepsy is a brain condition primarily caused by genetic and structural defects. It characterizes an imbalance between excitatory and inhibitory neuronal activity. Spontaneous seizures occur when there is an increase in neural excitability due to abnormal synchronous firing of neurons in the affected brain areas. Epileptogenesis involves the cellular and molecular changes that disrupt typical brain circuitry and lead to specific symptoms. Factors include structural defect, metabolic dysfunction, and genetic modifications. Increased excitation, decreased inhibition, ion channel abnormalities, neuroinflammation, and synaptic plasticity involved in the process. Hyperexcitability, electrical impulses, and the release of neurotransmitter glutamate cause seizures. The symptoms can manifest in various ways, including muscle contractions, jerky motions, sensory experiences, cognitive difficulties, and changes in behavior. Risk factors, modifiable risk factors, alcohol consumption. Drinking too much can lower the seizure threshold and raise the chance of getting epilepsy. This is especially true during withdrawal. Smoking. There may be a link between smoking and epilepsy, possibly because it changes the blood vessels in the brain oxygen intake. Sleep deprivation. If someone with epilepsy doesn't get enough sleep, their seizure threshold can drop significantly, which leads to seizures. Non-modifiable risk factors. Family history. A strong history of epilepsy in the family means that the person is more likely to develop the condition. Previous brain injury. People who have had injuries, particularly severe ones, are more likely to develop epilepsy later in life. Age of onset, early in childhood. People who have been diagnosed with epilepsy when they were young are believed to have higher chance of developing additional complications. Major signs and symptoms. Signs, unexplained falls. A seizure that makes the person lose control of their muscles can cause someone to fall out of the blue. Sudden behavioral changes. Unusual mood swings, disorientation, and abrupt anxiety during a seizure may suggest abnormal brain activity. Unusual sensations, feeling like tingling, deja vu, or unusual sense can be an aura that precedes a seizure and is a warning indicator. Symptoms, staring spells. This symptom is often seen in absent seizures, which is where a person appears to be staring blankly into space, indicating transient loss of awareness. Sudden jerking movements. Jerking is a hallmark for tonic-clonic seizures, in which the body experiences fast muscle contractions, potentially resulting in falls or injuries. Loss of consciousness. Losing consciousness can happen in a variety of seizure types and is an important indicator of severity. Severe seizure occurrence that requires prompt attention. Diagnostic testing, MRI. An MRI can find structural brain abnormalities, likely causing seizure-like activity. Electroencephalogram, EEG. The EEG uses electrodes on the scalp to capture brain electrical activity to detect irregular brain patterns linked with epilepsy. It can track seizures in real time, although it may require sleep deprivation and is not always conclusive. Blood tests. Blood work is done to rule out any underlying metabolic or genetic conditions contributing to the seizures, including CBC for infection, BMP for electrolytes, sodium, potassium, and glucose, and thyroid function test to check for abnormalities that can sometimes cause seizures. And here are my references. Thank you.